As a district nurse, I would have loved this. I would really have loved this. I was 20 years as a district nurse and I would have found this really, really helpful. The referrals that we got from patients coming out of hospital or sometimes from GPs were sometimes not great. So as a practice nurse, from a practice nursing point of view, it's good. I think it seems really easy to use. I think it's quite self-explanatory. I don't think it's difficult.
One thing you'll see is that if a patient has died or if a patient's declined to share, if they've opted out of sharing, when they opt out, there's a read code put on the GP practice record.
Okay.
That stops EMIS from actually sending us the data for that patient.
All right.
So you have a search here, NHS number, you know, the more you can put in, obviously the more precise the search is.
Yeah.
Because if you just search for Smith, you know, you're going to find an awful lot across Stockport. So if you know the first name or the date of birth, it does just narrow it down. So we have a test patient here. Clicking on the header will take you through to the consent model. Now the consent's important. If you ask somebody and they're sitting in the room with you, you know, is it all right for me to look at your record? And they say, yeah, well, fine, anybody can look at it any time, not bothered. Then you click on that first option there, which is indefinitely. If they just say, well, yeah, that's fine for today, you can click on just relating to today's consultation. If they say no, there's the option to say consent denied. And basically that's it, you're stuck, you can't go any further into that record.
And is that just for this consultation?
Yes, it doesn't block any other consultations, so it is only just for this one instance.
Okay.
Because the next option here, break glass as it's called, for emergencies or other. So if the patient's not with you, but you have to look at the record because it's an emergency, it could be when you select a drop-down list, the patient's incapacitated or due to mental health or they're unconscious. You have the option as well, if any of those reasons aren't suitable, if you click on other there, you can type something into that box and click proceed. It'll be saved to the audit trail, so if there's ever any questions, why did you look at the record, we can go back and we can look at that. But if it's not an emergency and you haven't got the patient with you, there's this option here which is other. This is a test version, so it doesn't have the full list in it, but it does say to check appropriateness of a referral. So if you were a DN sitting in community, you wanted to look at somebody's record before you went out to see them, it would be perfectly reasonable for you to say that. So you have a number of choices there, and again, there's that other. Seems a bit of a contradiction having other and other, but it's just the way it's set up. But again, you can type a reason in there and then click on proceed. What that's going to do is it's going to take us to the next page. What we've got here though is we have an icon, the triangular warning sign. So if there's any alerts against a patient that have been pulled through from the practice record, so allergies, anything like that, intolerances, they will pop up on the screen. So you'll actually see that pop up in your face. You can either click on view to actually read more detail, or you can click on close to just shut that down. On this header, if you click the header, you'll get more detail. If there are any phone numbers recorded there, you'll be able to pick that up from here. Again, this part for a practice nurse is probably not all that useful because you can see that in your own patient records. But again, if you're a social worker or if you're out in the community as a DN, occupational therapist or something, this becomes far more important as a set of information. Care-centric is the name of the product. We call it the Stockport Health and Care Record, SHCR. It's the company that writes it, GraphNet, that brands it as care-centric. Everything you see on this patient landing page is based on role-based access. So there are 25 different job categories. There are only actually 5 different landing pages for those 25 categories. So a practice nurse would probably fall into the same category as a district nurse, as an advanced nurse practitioner, things like that. They would all see the same sort of common landing page. What you can see at the top of the screen is that there's an EPAC. That tile will be there regardless of whether there is an EPAC record or not. It's designed to just to let you know yes or no. And one of the things that I need to sort of get across really is that even though this looks completely different than the old version, what's sitting underneath it at the moment is identical to version 2.
Right.
So in the case of all the blood tests and all those sorts of things, no difference at all. It's only as we move forward, having migrated to this, that as we get the data sharing agreements in place, we'll be able to start putting in information from, say, Pennine Mental Health, from the Christie. So if your patient is being treated in the Christie, you'll actually be able to see the treatment record pulled through into this. So as a shared care record, this will become much more data rich than it already is. There's two ways to sort of view everything that you can see on the screen. You can just scroll down and wait for the sort of records to fill in, or you can take a shortcut, which is basically these icons at the top. They don't take you anywhere else but the right place on the landing page, but it's just a quick way to get there. So if you need the meds, that'll take you straight through. Now obviously this is a test patient, so it's not very data rich. It doesn't have a lot of information in it. If there is a lot of information there, you can see here on the right hand side of the page there's an arrow. That allows you to drill down to the next level and to more detail. So you can see the last prescribed date. It will tell you if it is a repeat medication, you'll be able to see that from the dates, and you'll see the dosage and the quantities that have been prescribed. You can go back to the record. Some of these won't have any data sitting in them, so the social care data isn't being pulled through automatically at the moment. But what we do have is we have sitting behind this some features from version 2 which haven't been converted yet. And one of those, if we click on view and go to folder view, what we'll see is the version 2 part that's sitting underneath this. So this is only really sort of stage 1 in a sort of progressive move to what is going to become a Greater Manchester record. So it's not going to be just Stockport. This folder view, to anybody who used version 2, is very, very familiar. Not so as much to yourself because this is relatively new. But under here, this integrated record, there are two features which are important. If you're a GP, either in master calling out of hours or in practice, they have access to this FT portal which allows them to go into a series of records actually within the hospital's own system, which allows them to see what the current treatment is, whether the patient's in hospital. And I know it's something that Dr. Gilman uses quite often if he's trying to track down where one of his patients is. And there's this other link which is a social care activity. What this does is this links through to the council's adult social care Care First system. What it does is it shows their social care plan if they have one, and also their goals and risks assessment. So if somebody has a relationship with adult social care, then you can see that information as well, and you can see the core data that's recorded in the council system. So we have those two there. You can see that the Stockport EPAC record is there for this patient, but if we move back to our other view, we also have here an icon which isn't very obvious, but it's actually documents. So when we click on that, you could create a new record. So if you wanted to start a new EPAC record for end of life care, you could. In the case of this patient, we know they already have one, so you can view published. So you can see here, there's the EPAC record. Now if you just want to view it, you just click on it. If you want to edit it, there's an icon here. It's been tailored very much, the new consent, to address an issue with district nurses. Because a lot of the DNs say, well, I'm not seeing the patient, I don't have explicit consent, it's not an emergency, they don't see that other option that's in the new version.
Yeah.
So when they see that now, they'll be able to see, yes, it's a referral from another professional,
Yeah.
and I'm looking at the record because I want to go and see the patient, and I want to know about them before
that's
I go
good.
and see
That's
them.
good.
So trying to overcome that sort of slight reluctance to be seen to be using the record inappropriately.
Yeah, no, it's good.
So we try to change
It's
that.
really good. Be really helpful.